Hi, I'm Graham Zirkin, author of our Mental Health and Criminal Justice report, which we're launching today. Just wanted to say a few things about what the report's going to tell you. We conducted a consultation across England and Wales and spoke to over 200 people. That included prisoners, ex-prisoners, but also people working in the prison service, in probation, in courts, mental health practitioners, right across the scale. And the findings across England and Wales were quite consistent. Now it's a year old and a lot has happened in that time. When we did the work, probation services were going through their biggest, most recent set of reforms, and so one could wonder whether or not our findings are dated. However, we've done a lot of work since, and also that work and also recent inspection reports, particularly on prisons. The vast majority of offenders have mental health problems or some related type of vulnerability, particularly personality disorder and substance misuse, as well as part of that. And very often they don't just have one problem, they have a whole multitude of problems. So the default for offenders is really to have multiple and complex needs. And that requires a joined up response. So it makes them a challenge to work with when they're in prison, when we're trying to rehabilitate them, and when they leave prison as well. And we don't think that services are currently set up to address that. One of our findings was that the resettlement experience, i.e. the re-entry to society from prison, is particularly unsatisfactory, and particularly those with marked vulnerabilities. As I've said before, the bulk of offenders, people leaving prison, will have multiple and complex needs, and very often they've got immediate needs like housing, access to some sort of finances so they can survive. And if we don't get things right around that and the right supports in place, particularly for the most vulnerable prisoners, we're likely to see those people reoffend. There are some great services in our prison system and also in probation hostels, etc., for people with personality disorder, but they only serve a very small number of that group, so those are the highest risk offenders. And our consultation found that those services, both the people who use them and those who provide those services, that those who visited those services, that they've got a great reputation and are very well received. The vast majority of prisoners have personality disorder or some sort of traits of personality disorder, but don't benefit from these services. And we think that all staff working with that group of people need to be trained in the sort of skills that staff working with high-risk personality disorder offenders have. We think that needs to be spread right across. And so any awareness, mental health awareness training really needs to have, and we're not just talking about mental health practitioners, we're talking about prison officers as well. There are skills, if you want to have successful outcomes with these people, that you need to have. You need to be able to communicate, to understand how they react, how they mentalise things. We thought that leaving prison ought to be treated as a time of crisis, particularly for prisoners who we know have mental health problems. And what might that mean? Well, we thought that the Crisis Care Concord Act really ought to apply to this group of people as well. The Crisis Care Concord Act is out there to improve the response to mental health crises, and there's no question that leaving prison with very little in the way of accommodation or support, and often no service that will accept you, is a time of crisis, and that local commissioners need to work together with NHS England, with probation services, to improve the response for that group of people.